Heart attacks, how to prevent them. In patients with ischemic disease, to eliminate deep breathing by progressive muscle relaxation of the heart, it is required constant monitoring of the relaxation of the skeletal muscles and diaphragm, which leads to shallow breathing. During the day, the patient should reduce the depth of breathing at rest. You can reduce the depth of breathing while lying down or sitting on a chair. It is important to ensure that your breathing is not deep. Patients should learn that deep and noisy breathing leads to decrease in carbon dioxide content, which leads to deterioration in the transport of oxygen by hemoglobin to the body tissues. It is important to monitor the decrease in depth of breathing during the day at rest. Breathing, both at rest and while walking, should be inaudible and invisible to the eye. Therapeutic walking in case of pain in heart. The patient should learn to walk with shallow breathing. Usually, to reduce the frequency of anginal attacks, it is enough to maintain shallow breathing while walking and throughout the day. Such patients immediately observe a decrease in pain in the heart area. It is important that the distance and pace of walking do not lead to disruption of breathing and that shallow breathing is maintained at all times. You need to choose a walking pace that excludes deep breath. If your breathing deepens while walking, you should avoid excessive exertion and have a rest more often until shallow breathing normalizes. Therapeutic walking is carried out on an empty stomach or 2 to 3 hours after eating. At first, it is better to use slow walking with shallow breathing, gradually increasing the duration of such load. In order to increase the effectiveness of therapeutic walking, you can use personally selected routes. Depending on the patient's condition, such routes can be lengthened in terms of distance, intensity of walking, and time. The duration of such therapeutic walking can vary from several minutes to 1 hour daily. Therapeutic walking with shallow breathing can only be performed on an empty stomach. Some patients with coronary artery disease remain at the first stage and notice improvement in their general condition. After improving health, some patients begin to master the second or third stage. Typically, patients begin to walk slowly with shallow breathing. When breathing is deepened, it requires to stop and have a rest breathing shallowly. After the return of shallow breathing, therapeutic walking can be continued. While breathing shallowly, patients notice a decrease in pain in the heart area. After your general condition improves, you can begin to master the second stage. Subscribe to my channel to receive a message about the broadcast of the second stage of the method of elimination of deep breathing using progressive muscle relaxation.